Okay.
Hey, how are you?
Hello, welcome to the first meetup of Data Karka here in GE Healthcare. We will have two presentations today. Gregorio is going to talk about challenges of healthcare data in data science. And then we have a short break for pizza. And afterwards, Vladimir will show us how to get our hands dirty with solving the problems on Kaggle. But before we begin, I would like to introduce you to someone very special we're very lucky to have here today. Ferreira is our CIO and also the site leader for this office, and she would like to welcome you all here. She has very technical background, so she's very excited about what's happening here.
Very technical, that's questionable when I look at all the scientists here. So, hey everyone, welcome. Thank you for making the time and coming out here. So as Maria mentioned, I'm Leila Delic. I'm one of the CIOs of GE Healthcare company, and I'm also supporting Krakow site. So I'm traveling between Poland and rest of the kind of geographies. So big data is an interesting topic. It's a hot topic for many years, but for healthcare especially it takes a different meaning. Obviously in the world, right, there's, we just as GE also announced industrial internet, GE digital. So all of these changes in the world and the things that we are aiming to achieve through data has an immense impact on the world. So I'm very excited to listen through some of the sessions. Whatever I don't understand, I'll reach out to our scientists here. But again, thank you and make the best out of the event. Let me know during the break if you have any questions for me. So welcome again. Thank you, Maria, for the time.
Well, thanks for the introductions. Before I start, I would like to ask to all of you to help me to do one more dynamic presentation. Don't keep the questions for the end. Just stop me and make me as many questions as you want. I have 2-3 kind of a speech prepared for today, so it depends on the type of questions or the feedback that I'm getting. I will go in detail in more things than others. So let's see how it's going. Yeah? So for today, I will do a short introduction about myself. Then in relation to big data and data science, I will try to talk about what has been said before and now. And then go in detail to what's healthcare data, what healthcare is, yeah, how we can leverage the data coming from healthcare systems, and then go in detail to what is EHR and electronic and medical record systems and where you can find this type of data. So before, I would like to share with you this video. It's very descriptive of what can we do as a data scientist when it comes to healthcare. one question for all of you. Why do you think that GE is spending so much time and money and effort on saying about industrial internet? Why not keep it simple and say it industrial Internet of Things? Yeah. Does anyone here have the chance to learn a little bit about industrial internet and why is industrial internet and not Internet of Things? Okay, so I will figure out how to motivate all of you to challenge me, okay? The thing is that why call it industrial internet? Well, so far, big data is used like the flow of data coming from one point to another and in a manner that is technically correct or possible or feasible to deal with that data. The thing that we call it industrial internet is because a part of being able of accessing the data or transfer the data, so create this flow of data, we need to comply with a lot of regulations when it comes to the healthcare and a part of all the security. So this can give us the opportunity to understand how the source of the data and the people who want to make useful to make something useful from this data, we can understand all these connections and most probably provide better insights about this. Yeah? So that's the reason of the video. Well, about me, I'm originally from Venezuela. In 2003, I decided to move to Spain, and in 2011, I got my degree in industrial engineering with a minor in electrical engineering. So since then, and for my master thesis, I had the opportunity to start to work with data. And before going to my PhD and become a researcher and a data scientist, I decided to have some technical background, and I work designing power system for yacht and wooden boat. Then I became Marie Curie Fellow in a quite of unique research and development project led by the Imperial College. And right now I'm in the last stage of my PhD on a multi-criteria diagnosis of electric drive. Yeah. So in April 2015, I joined to the IT Process of Excellence team here. I'm working for the innovation team, European innovation team. I'm based here in Krakow, and among other projects and collaboration that I have with different teams, my mainly task is develop systems that are capable to understand how the magnetic resonance system behave, the MR system behave, and how we can provide better service to this system and therefore to the hospital, and improve the uptime, the availability of this system to the patients. Yeah? So this is how my organization looks like. I'm there, so we're not so many people, but I will say that everybody there is really brilliant, and I'm trying to be a little bit more like them, yeah? So, but what has been said, yeah? So before, you know, internet is only, I don't know, 50 years old, yeah? So in the late 90s, yeah, internet started to become available for the masses. So that means that the flow of information and the amount of people accessing to it became you know, massive, yeah. Till 2010, that all the IT companies, they start to have a problem to have to handle all of this. So in 2010, 2011, people start to talk about big data. So since then, and around 2013, big data became mainstream, and nowadays it's a hot topic, and I think that's why we are all here. Yeah. So as an example, today it's possible in an Airbus 6000. Yeah, the Airbus company, they install a Hadoop instance in the airplane, and they are capable of processing around 1,000 sensors in an old models. New models, they have up to 1,000 sensors in each wing, and they are capable of processing this online. All of this is not only thanks to the big data technology, it's also thanks to the sensor technology, which is somehow is pulling the limit of the big data and how to access to the data and how to make accessible this data. Yeah. Please let me read this for you. Yeah. This is very descriptive. Big data is new and ginormous and scary, very scary. No way. Big data is just another name for the same old data marketers have always used. And it's not all that big, and it's something we should be embracing, not fearing. No, hold on. So as you see, here is a good representation of what big data is. Yeah? No one knows. Yeah? Everybody is trying to pull the definition of big data to their own field, and they are trying to be the first or be the expert in that area, and they want to all call that area big data. So the important thing to remember here that we shouldn't stop talking, we should stop talking about big data. Let's start talking about smart data. Smart data is not only the amount of data. Smart data is a process, it's a workflow in which someone has a question that then come to us, to the data scientists, or to people that are, or to the data analytics as well, yeah, in which we can provide better insight and understand what is happening or what information is hidden on these data sets. Yeah. But we should be aware that more data doesn't mean that we have a better insight. Yeah. In this article, they asked to 12 experts, let's say, and one of them wrote this, I will say on purpose, just to call the attention that not because it's big, it's better. Actually, there are more articles about this, and I like this. Yeah, more data does not equal to better insight. There is a lot of garbage, as we call it on data science. Yeah. So let's do some examples about this. Yeah, I like this. This is my favorite. Yeah, if you burn all the data created in just one day onto DVDs, you could stack them on top of each other and reach the moon twice. So, but I'm quite sure that maybe 80% of all those DVDs, we don't need them. Yeah. So, not because we have the capability of creating data, we will have the capability of get better insights. Yeah, we should get a compromise between quality and the skills of people dealing with that data. Yeah. So over 90% of all the data in the world was created in the past 2 years. That is an important fact. And it's expected that by 2020, the amount of digital information in existence will have grown from 3.2 zettabytes today to 40 zettabytes. So if we stacked all the same type of hard drive, I think that we will need to cover all the office and go to one of the other flows, other levels. Yeah. So there are more links which you can access and get more information. This is people that they are leading the field. So I can recommend you to read this, and then from here you can follow your own path. Yeah. But what about big data and healthcare? Well, so the American Medical Association is embracing all this new technology. Yeah. And what is important is that now the hospitals, yeah, they are getting the green light, yeah, of taking risk and taking and being able of taking decision of investing on big data and data science technology for hospitals. So a part of all the technical needs that they will require companies that will support them, they also receive the support from the government, which in most of the case is the milestone to beat whenever you want to innovate, especially in healthcare. Yeah. There are also similar initiatives here in Europe. There are some governments, especially in Eastern Europe, that they are funding a lot of research projects related to increase the quality of the social healthcare system. So, which is good for us, not only as a data science freaks, more is good for us as a society, that perhaps we will get a better services, lower cost, and we will be more healthy. Yeah. So one of the new opportunities here is that today 70 people They are capable of treating 70,000 patients of asthma. What they are doing is they are mixing database of the location of the patients with weather.com and pollen.com. So using machine learning algorithms, they are capable of predicting what the level of pollen in the air will be for the next week, and they are starting to deliver it automatically. Yeah, actually using Amazon, by the way. They are delivering the inhalers for people with asthma. So this is a really a good example in our field. You know? But let's get a little bit on more details. This is what I'm doing as a data scientist. Yeah. So someone made a question. Yeah. So we don't call it more big data. We call it smart data. So someone made a question. So this question was, can we minimize unplanned visit by leverage the planned visit? So that means that are we able to predict when the machine is going to fail? Can we learn something from the historical data, the service data that we have, or machine log data? Can we take this information today and make something useful for it? So my answer was like, yes, we can. Yeah. So after spending 2-3 months cleaning data, finding data, talking with a lot of people, because the concept of big data in internet, which is the manipulation or is accessing to data related to different web stores or to physical stores for the same frankenship and so on, is not the same type of problem. It's not the same technical challenge. Yeah. So when it comes to MR systems, we have to deal with security issues. Yes. We have to keep the we cannot relate the data to any patient. Actually, the machines itself, they don't keep that record. And then, of course, the business sensitive data. For example, if I take data from one hospital and I can get the numbers, and other hospitals can take these numbers and see how well are they performing with the same system installed in their facility. Yeah? But so far, we are getting progress on this. It's a really, really great challenge for me as a data scientist. I come every morning really happy to do my job, because a part of making the company to give a better service to our customers, we are also making this system, in this case MR system, available more often, more reliable for the patient. So imagine that my thoughts every morning is, what if I can add one more day to each of these systems per year? That's my first goal. My second goal is, what if this system can work 5 more days per year? So imagine the number of patients that we can treat with that, and imagine what is the benefit for our customers in relation to usage and cost of operations. Yeah? But as all of you who has experience as a data scientist, we spend 70% of our time as a janitors. Yeah? So we have to take all the data in the way that is coming. Most probably the company that you are working for, they don't know what data do they have. So you have to do a lot of iteration between the guy that had the question and the people who controls where the data is. So this was one of my propositions. Because of confidentiality, I had to simulate the case. But what I did for them is to help them, to help the service team and help the managers to do better questions to me. Yes, I just split the data, yes, into a calendar, and I told them, for example, there is one system that in this day that we had a preventive maintenance schedule, yes, in the day after it, we had a problem with this. So there is a new question here. Are these preventive maintenance triggering new corrective actions, or our field engineers are so expert in their field that when they are there doing the preventive maintenance, they have the capability of detecting that something else is broken and they open a new job. That's why they go the next day. Or why we have to visit the hospital 4 times to help to our customers. So here looks really nice and clean. I spent basically 1 month just to put together from all the different data sources to put together all this information and being able to represent this. This is just a frequentist analysis of the events, yeah? So in which the events are classified as a preventive action or as a corrective action. Yeah? So what I'm trying to do is just creating a data-driven model, yeah? I'm using engineering concepts such as reliability. Also, I'm looking into the sensor data to see what are the parameters that trigger a fault, what are the logs on the machines, if our machines are smart enough to understand what is happening to them. So in fact, what we're trying to do is just split the magnetic resonance system into their subsystem, into their components, and by understanding how these components behave, we can come up with a model that at least will give us a good prediction for the next week or 2 weeks, ideally. Yeah. So,
sorry.
Yeah.
Aren't the machine meant to work 24/7?
Sorry, can you repeat?
Aren't the machine built to work for the people 24/7 without any breaks? So I'm just wondering, instead of looking for the pattern when the machine will break, or what's the probability, shouldn't we focus on making the machine working, fully without the break?
You have never seen a magnetic resonance system inside, right?
Yeah.
Well, no, I wanted you to make a joke from that. No, you are right.
This is example. Okay?
Yeah, but imagine what will be the cost of this. Yeah, not from us as a company. What will be the cost for the customer? Imagine that you say, like, well, I'm a customer and my financial statements are really good, and I say I want a machine that never fails. So instead of having copper wire, we need gold wires. Yes. Instead of having the magnet with neodymium, some of the variation, you can have the one that is more expensive. So if you add all of this, yes, then ideally, again, you will have a machine that will fail less, but the cost of operation, yes, and the system itself. So for example, in the case of MR systems, yeah, you cannot do sequential exams too often. So that means that to generate the amount of magnetic field that you need to do to scan, I don't know, the arm, is big enough to overheat the system to a level that you need to wait 5 minutes, yeah, to be able to do the next exam, yeah. So it's not that the system fails too much. There is also a component, the age component. So this is the human factor. Whenever you have a human dealing with a system, you have a variable that you are not able to predict or to quantify. So this messes up everything. Yeah. So just to close the question, I hope in a way that satisfies your curiosity. GE has the best MR system in the market. That's for sure, because Siemens and other companies, they behave really worse than us. So imagine that today we can say our systems are better, and even like this, our system fails. So imagine what is happening with the others, yeah? But as an engineer, I never saw a system that never fails. That I would say that this is the unicorn, yeah? So no matter how rich you are. Yeah? So a Ferrari always fails, yeah? That's why you have specialized mechanics on Ferraris, yeah? Yeah, everything fine till here? Someone wants to say something, challenge me because I said something that it was too obvious, and you would like me to show that I can do it better, or so far everything is clear? Well, no answer means that I'm right, right? Yeah. So let's go to the challenge of healthcare data. To be a data scientist in healthcare, the first thing that we need is to have the data. So what are the sources in which we can rely on the information that we can access from them? Well, so PubMed I think that guys, all of you are ITs like me, engineers perhaps. So we all know IEEE. So PubMed is for medicals, the same that IEEE is for engineers. Yeah? So if you want to publish something related with biology or medicine, you would like to publish to PubMed. So let's say that this is the first source of papers which reliable information. So we need to figure out how to read them, right? So then you have PubMed Central. It's also a free database. So this is how it looks like. You can perform some internal search using the internal search engines, and then retrieve the metadata and then the file. Yeah. So when it's come to image databases, you have Cancer Image Archive, so TCIA. Then the Cancer Genome Atlas. All of these are open source resources. Yeah. And the community is helping